Hello, my name is Laura Mosqueda, and I'm delighted that we can show you what the next phase of your training could look like.
Keck School of Medicine, we pride ourselves on challenging paradigms and thinking outside of the box.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
The training you get here is as hands-on as it could be.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We take on the toughest challenges, the toughest cases. We take on the biggest questions for research to try and make a difference and improve human health.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interests supersede self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. That's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yeah.
Yes.
These are the patients that, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom, this could be my dad, this could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Dix in here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new?
No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, But equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever.
We really want an inclusive environment where you can be the thought and the change leader on our campus.
If you come to USC, you will be part of a close-knit, collaborative Trojan community.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
Hi everybody, my name is Charlie Manchi. I am one of the graduating Consultation Liaison Psychiatry Fellows here at USC. Consultation Liaison Psychiatry Fellowship is really learning, you're taking already trained psychiatrists and training them in ways to work with other doctors and how to communicate with other doctors and treat and advise them how to give the best care possible to their patients. In addition, it's a place where you can learn how to deal with specific conditions that are less common for a general psychiatrist to see, that really have a lot of overlap with medicine. Things like psychosis from medications, or autoimmune disorders that have mental health outcomes, or sort of things that are more common like fibromyalgia and chronic pain conditions that have a huge mental health component to them. Our fellowship program is split pretty evenly between inpatient consults and outpatient consults. You spend about half of your time on one of our two consultation services, both at Keck and at County, and the other half are in a variety of clinics that you do longitudinally throughout the year, both at Keck and at County. So this experience can be a whirlwind at times. You do a lot of things throughout the year, and I think that they all add together to really make a very complete psychiatrist. And you get to interact with a lot of different humans, both faculty, other trainees, patients, that really add to your experience going forward. I think the combination of both Keck and LAC really adds to the already incredible variety this program has to offer. Over at Keck, which is an excellent academic center, you see a lot of conditions that are pretty rare that you wouldn't see at other sites, and you work with a lot of very academically oriented faculty who both push you clinically as well as sort of try to get you to engage in academic projects like research, as well as go into conferences. On the LAC side, you obviously it's still a very academically oriented county system, but you see a lot of sort of the patients that we have are low income, low resource, operating in a system which can be very challenging for them to navigate. And you end up seeing a lot of sort of common diseases taken to their extreme. And as a consult psychiatrist, you end up working a lot in severe mental illness and how that interacts with medical illness in a medical setting. Access to care is always harder for our patients on the county side, and our job is to sort of help them access that care and give them the care that we can while they're here. The patient population that we see on the county side, there's a large homeless population, and an even sort of larger underserved, under-resourced population, including a large immigrant population that we're serving here. It's an interesting experience to sort of break through with a patient. Obviously it's very rewarding. I think can really sort of, it happens hopefully every day that you see a patient that hasn't really gotten access to care, and you sort of are able to change that for them. And the next stage is planning on how to make sure that they have that access going forward. So it really feels important to be able to make that kind of change in someone's life. No one's turned away, and that's I think important, especially for LA, where we have a lot of people who don't have basic needs that are living within blocks of this hospital. So I think it's important that we're able to give them the care they need. Just like you do at the hospital, out in LA, you see a wide variety of people. You're going to interact with a lot of different cultures, a lot of good restaurants, music, not right now, but bars, that you get to sort of see a lot of different humans. With the campus, it's divided. We have the Keck Hospital, you have the County Hospital, and in between you have the medical school, and they're all walking distance from each other. It's very easy to go from one to the other throughout the day. I'm always been partial to cafeterias. I think that's the most important part of any hospital. And we have three excellent cafeterias on our hospital campus. all of which as a trainee you get relatively free food, which is important when you're a trainee. Coffee is important, lunch is more important to me. On all the services you'll experience during this fellowship, you work very closely with both psychiatry residents and medical students, which gives you a lot of opportunities to sort of teach and mentor people who are coming up through the system that you've already been through. In addition, you also work pretty closely with medicine residents in their outpatient clinic where you work as an embedded psychiatrist for the whole year. So you get the opportunity to sort of train them as well. It's a very enriching experience. During sort of becoming a psychiatrist, it's easy to feel siloed into sort of treating mental health. But we are sort of also general doctors that sort of understand a lot of other things. And it's important, I think, to sort of be able to communicate our expertise with those doctors that are treating mental health day in and day out in the primary care setting. We know that things like depression influence your outcomes for diabetes and respiratory health and obesity. So it's important that we as psychiatrists really engage the primary care doctors who are dealing with these conditions that depression worsens to make sure that both us and them are really actively engaging patients with depression. I think you have to balance sort of all of the needs you know the patient has to what really can exist for that patient. We can't solve every problem every time. We meet the patient where they're at with what they're willing to accept, what we can provide, and then everything else we give guidance to move forward from there. We do deal with a lot of very heavy topics day in and day out. And a lot of fellows in the past have had their own personal therapist that they see, and that time is provided for the fellows to go do that. The fellowship also has created a very engaging atmosphere between fellows and faculty, so they feel very supported. I have felt very supported throughout this year by my faculty, and there's a sort of routine check-ins with your mentors. They provided a few retreat-like events. We went and saw a movie at the Hollywood Bowl. We went and did an escape room together. Sort of ways to decompress outside of work to sort of let some of that sort of heavy feeling go. Both me and actually my co-fellow are both staying on as faculty, which I think speaks to sort of how welcome we have felt throughout this year here as a fellow. And I'm very excited to be able to sort of help shape the future of both our psychiatry residents here and our future psychiatry fellows.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.